and gentlemen, it's my great honor to make this presentation to you. I am Tomohisa Nagasao, a plastic surgeon from Japan. I extend my gratitude to Professor Gosai for inviting me to this conference. Today, I am going to talk about a simulation technique that I think is very useful for the practices of clinicians, such as orthopedicists, orthodontists, and of course, plastic surgeons. I have given today's presentation the title, Prediction of Body Shape with Biomechanical Techniques. First, let me start by showing you 4 kinds of treatment and asking you a question. Each of the treatments you see here is quite frequently conducted in the practice of plastic surgery. First, breast reconstruction with a tissue expander. Second, application of braces to correct teeth. Third, destruction of the upper jaw for craniosynostosis. Fourth, correction of eyelid ptosis with fascial transplantation. My question is, what do these 4 treatments have in common? Here is the answer. All of these 4 treatments intend to change the shape of the patient's body by applying force. With breast implants, we expand the skin by pushing it from inside. With braces, we correct the shape of the dental arch by using the plasticity of the braces. With destruction, we put on the upper jaw. Naturally, force works to change the facial contour. With eyelid ptosis, we suspend the eyelid with the fascia. So, all these treatments correct the patient's body by applying external force. If we change our patient's body shape by applying forces in our daily treatments, then to provide the best results for them, we need to predict how these shapes change. I am developing an original technique for this prediction. The aim of this presentation is to introduce this technique. Let me first explain why I initiated my study. Every plastic surgeon has his or her favorite operations. As for me, I love to work on chest deformities. A considerable number of people, about 1 in 300, worry about their chest shapes. As you can see in these pictures, certain parts of these chests are caved in. This condition is formally called Pectus excavatum. In simpler terms, it is called funnel chest. The treatment of this condition is my life work. Let me show you a short movie of an operation for this condition. We place a U-shaped metal bar beneath the sternum and flip it upside down. By doing so, we push up the concave part of the chest. By performing this operation, the deformity of the chest is corrected. The concavity that had existed before the operation disappears. The patient is happy, and I'm happy too. But occasionally, I encounter cases where the result is not so good. For instance, please look at these patients. The concavity at the center of the chest has surely disappeared. But as the arrows indicate, the costal arch protrudes, presenting uneven shapes. The reason for this phenomenon is very simple. As the depressed part was elevated, so was the costal arch, which did not need elevation. This phenomenon occurs with some patients, but it doesn't occur with other patients. The difference occurs because the shape and hardness of the thorax differs from patient to patient. So we need to predict the outcome beforehand, since if the irregularity occurs, the patients will not be satisfied. If we can predict the problem in advance, we can take preventive measures. For instance, by severing the sternum, we can prevent protrusion of the costal arch. Out of such clinical necessity, we have sought ways to predict the changes of body shapes resulting from operation. Now, the purpose of my study should be apparent. Next comes how. How can we predict the change of human body shapes? As a solution to this problem, we use a biomechanical technique called structural analysis. Structural analysis is widely used to predict the dynamic behaviors of products. Here is an example of structural analysis in use. The picture shows a part of a car engine. As the car moves, intensified stresses work on the part. Because of the stresses, the part bends. To improve product reliability, we need to predict how much the part bends as the stresses work on it. Structural analysis is used to solve such problems. Let me now explain the basic principles of structural analysis. When objects have complicated shapes, it may surely appear to be difficult to predict how their shapes will change in response to forces. However, for objects with simple structures, the prediction is easy. For instance, with simple springs, as shown in the picture, it is easy to predict how much they will expand when they are pulled. Similarly, it is easy to predict the degree to which a beam will sag when a force works at one of its ends. We can predict this by simple physics calculation. Thus, with simple structures, the direction and the amount of transformation of their transformation in response to force can be predicted by simple calculation. Here, I'd like to draw your attention to the fact that however complicated an object is, it can be divided into simple components, and the dynamic behavior of each component is predictable by simple calculation. For instance, when we want to know how this gate sags when it is pushed downward, we divide the gate into small components as shown in the left figure. By calculating the dynamic behavior of each component and accumulating the results, we can predict how the original gate will sag. Likewise, going back to the original issue of the thorax, we can divide the thorax into its components, such as ribs, sternum, and cartilages. Then simulate each of these components with appropriate models. By combining the components, we can simulate the original thorax with a biomechanical model. Please look at the right figure. The thorax is modeled as an entity consisting of beams and springs. After modeling is completed, we can easily calculate how the shape of the thorax will change in response to forces. In the operation for Pectus externum, the depressed part, point Q in the figure, is elevated to the position of the highest parts, point P and R. Given this condition, we can perform calculation and predict how the shape of the thorax will be changed after the operation. This is the lateral view of the prediction. This is the bottom view of the prediction. This precision technique is quite useful in planning treatment strategy. For instance, prior to operation, we can decide how many bars we should use. We predict the shape of the thorax for situations where 1 bar or 2 bars are used, respectively, and compare the expected results. In this case, the shape for 2 bars is better than that for 1 bar, so we should use 2 bars. Doing this preoperative planning allows us to achieve optimal results. This is a short summary of my introduction. When forces work on the object changes its shape. We create a mathematical model, divide the object into small elements, and perform calculation with each element to predict its dynamic behavior. By accumulating the results, we can predict how the original object will change its shape. This technique is called structural analysis. We use structural analysis to predict post-operative shapes of the body. Besides predicting post-operative shapes, structural analysis is also useful in clarifying the mechanisms of trauma. As an example, this is one of my previous studies about blowout fracture. As you all know, blowout fracture is a quite frequent trauma, and plastic surgeons often encounter it. Since it can result in serious complications, this trauma is a great concern for plastic surgeons. So many studies have been conducted in the past to clarify the mechanisms of blowout fracture. In most such studies, cadavers are struck on the orbit by dropping weights, and subsequent fracture patterns are examined. This experimental procedure of dropping weights assumes that the impact is applied in the horizontal direction, meaning something comes from the front, heading backward, and hits the orbit in the horizontal direction. However, I suspect this often isn't the case. In my opinion, when something comes from the front, a person is likely to notice it and look downward to avoid it. In that case, the object wouldn't hit the orbit in the horizontal direction. Therefore, in reality, blowout fracture should occur more often in situations where the orbit is struck obliquely rather than being hit horizontally. So I was interested in how the severity of the fracture is affected by the striking angle, and conducted a study to clarify this theme. First, I produced skull models simulating human skulls. Then I applied impacts at varying angles. To be more specific, impact was applied horizontally 15 degrees upward and 30 degrees upward. By using structural analysis, we can quantitatively evaluate the stresses occurring on the orbital floor. The red part indicates the region in which fracture is expected to occur. While performing simulation, we need to examine whether or not the simulation is correct. To secure the validity of simulation, we performed a verification examination by dropping a weight on actual skulls. Comparison of the fracture theoretically expected by simulation and the fracture occurred on actual skulls in the verification experiment presented optimal similarity. Thus, the validity of the simulation was proven. These are the expected fracture patterns for impacts at 3 different angles. The area of the fracture is greatest for the impact directed upward at 30 degrees. This means that blowout fracture is more likely to be serious when the impact is directed upward rather than in the horizontal direction. I was initially surprised when I found this, but when you think of it, this finding is quite a matter of course when we consider that the orbital floor is not actually parallel to the Frankfurt horizontal plane. When impact is applied parallel to the horizontal plane, as shown in the figure, only a part of the impact, as shown S1, is transmitted to the orbital floor. So the orbital floor doesn't bend so greatly. On the other hand, when impact works parallel to the orbital floor, its whole energy is transmitted and the floor bends greatly. Accordingly, serious fractures occur. Therefore, we can conclude that when the orbit is struck by an object moving upward, serious fracture is more likely to occur than when the orbit is struck horizontally. This study was published in the Journal of Plastic and Reconstructive Surgery in 2006.